Okay, so welcome to our Children's Centre. Within our Children's Centre we have many different activities going on, working with a range of professionals also. The life of the typical Children's Centre, we work with our health and care trusts, so we have the health visitors and community nurses working with us and we deliver stay, weigh and play sessions, enabling families to access for health clinics, weigh-ins. We work with the midwives to deliver midwife clinics. These are actively used by parents-to-be, and these are complemented by our birth and beyond sessions, working with parents-to-be for 4 weeks to provide information about labour, birth and supporting emotional wellbeing. Our breastfeeding support workers access the centre weekly on a Monday to provide breastfeeding support, and these groups are accessed really well by parents, and particularly we've noticed since doing the birth and beyond sessions, parents are accessing these much more frequently as they seek support from the breastfeeding support workers. We also work with the speech and language therapists to offer talking walking sessions and enable families to access services to support speech and language.
The benefits of the health service users using the Children's Centre are that they can come to a familiar place, see a health visitor that they may be familiar with. If they're not familiar with health visiting staff, that could be community nurses as well. It's a good way to get to know their health visitor or health visitor that they may land up seeing. Also, it's really good to build up relationships with the Children's Centre staff as well. We work hand in hand a lot of the time, so sharing information that's been consented to share and supporting parents, pointing them in the right direction.
It also gives the opportunity to find out more about the courses here, because we can talk to the staff that are here, and one of my mums came today especially because I'd asked her to come and speak to all the workers here about a group. So it's really beneficial for us all, really.
You might get them to come to a clinic where they sort of are really hard to pin down at home as well. Because there are some that you can't get at home because they'll never be in, doesn't matter how many appointments you'll send, but you've had a few that will actually come here.
Yeah, you can get them here.
Yeah.
Our parenting practitioners are based here at the Children's Centres. They deliver programmes including Henry, health, exercise and nutrition for the really young. So this is a programme for parents with children aged 0 to 5 years. They are able to access this with a creche facility based at the Children's Centre and have the opportunity to develop parenting confidence whilst learning about nutrition, exercise and all of the benefits for children.
We offer lots of different courses for parents across Worcestershire. So some of these courses or programmes are things like Family Links and Triple P, and they're really to help you with your parenting abilities or your strategies in managing children, because we know that's not an easy task by any means. The sessions you'll come to, they range from a 2-hour session up into 14 weeks, and they're kind of 2 hours a week. So they're different lengths depending on your family's needs.
Some of the other services that we offer within the Children's Centres are our stay and play sessions. These are supported by our volunteers who we actively recruit and support into the volunteer pathway to support with their career progression in terms of developing confidence and skills. So to support our community further, we've also been fortunate to be able to set up our clothing exchange and swap shop, so parents are able to come in and donate clothes and in return exchange for clothes of the next size up. This is a really popular service.
So we have different groups throughout the week, and we've got Sensory Babies that's happening this afternoon, and then on a Thursday afternoon we have a messy play, and then Friday morning we have Health with the Drop-In, Speech and Language User Centre, and also other partners and agencies, including speech and language, so it's really well used, which is really lovely.
Anybody can come and use the services, so like the stay and plays can be accessed by anyone within the community, and the parenting courses likewise can be accessed by anyone.
I think particularly say with Sensory Babies, You know, parents come with their new baby, they make friends, they can see lots of different equipment, different toys to play with. If they've got any concerns, they can speak to one of the staff about them. We can also let them know about other things that are going on. So if they're wanting to get out and about into the community, if they're feeling a bit isolated, we can suggest groups that would really suit either locally where they live or that particularly suit little ones.
This is Willow, my daughter, and she's 18 months old. It was amazing. We came here and there were so many things for her to play with. So many things that you just don't have at home. They've got the sort of like wooden toys outside that are like cars that she can kind of plug bits into, turn bits round. Yeah, she's developed amazingly, I think. I think her social skills are amazing. She doesn't bother if I'm sort of away from her for any amount of time, and I think that's from coming here, definitely. I mean, you get to talk to other mums, other parents in general, but mostly other mums, and the great thing is that you can compare anything from sort of what clothes you buy and what bibs you buy to sort of milk, breastfeeding, anything like that, and you have so many different people that you can talk to.
Yeah, I think the emotional and mental health side of it, so parents have fed back that they found life a bit tough, sometimes a bit lonely, emotionally they're suffering a little bit, and by coming to group and talking to other parents, it's really boosted their emotional and mental health, and that support from other parents in telling them that what they're feeling is perfectly normal and fine has really helped them.